Well, welcome back, everyone. You are looking at the Sunday school former president. Jimmy Carter teaches at. Despite being diagnosed with brain cancer, Carter is still chugging on. He will deliver his 700th lesson tomorrow morning. And his diagnosis and progress fighting the disease is something we are going to be talking about in the weeks and months to come. Taking a closer look, an estimated 22,000 new cases of brain cancer will be diagnosed this year. Here in Texas, around 1,700 people will get the disease. Dr. Matthew McCurdy with the Austin Cancer Center joins us live this morning. Good morning to you.
Good morning.
And I know, of course, obviously Jimmy Carter, his situation has been in the news, but we forget hundreds and thousands of other people are also dealing with this on a daily basis. You know a lot about Jimmy Carter and what's going on with his diagnosis. What can you tell us, and how are doctors attacking this cancer?
So he has melanoma. He's been under surveillance very closely because he has a family history of pancreatic cancer. In this case, doctors have not found the primary tumor on his skin. It could be on his skin, it could be on mucosal membranes, it could even be in his eye. So in his particular cancer, surveillance did not catch it early, but that I want to stress it's still very important to catch skin cancer early. For most people, skin cancer is caught very early, and it's very curable.
I was reading an article this morning. It said, you know, there were 4 spots that they found in his brain, and he is 90. Does that limit what doctors can do?
It does some, not in terms of the radiation, but it does in terms of the chemotherapy. Usually, two drug combinations are given for melanoma that has spread to the brain. In this case, they're starting with 1 drug.
What can people do who are sitting at home, who have a family history of this, or who know they've been out in the sun too much and they could be in trouble? Is this preventable, and what do people need to know early on?
So visit your family physician or dermatologist if appropriate, and undergo screening. Also, continue to wear sunscreen, hats, wide brim hats.
Also, another side of this story that we have seen covered is the former president's attitude toward this, and just, you know, full speed ahead, let's fight this thing. How important is that for other people who are also battling this disease to see that? Because a big part of it is the camaraderie and the relationships that you build, and the hope.
I think he's an amazing man. I think it is amazing for others undergoing cancer treatment.
For sure. And when we say hundreds and thousands, I mean here locally, how many patients would you say you've seen over the last year or 2 years that are dealing with this same thing?
This is a very common scenario, to have cancer that has spread to the brain. Now, in his case, he's being treated with stereotactic focused radiation to each of those spots on the brain, which is specific for melanoma. And he's actually being treated most likely on a machine called a gamma knife in Atlanta, whereas here we have a CyberKnife at the Brackenridge Hospital, which actually clinically it's the same, but you don't have to have a head frame and screwed into the skull. So it's interesting that he perhaps would be getting a more comfortable treatment here in Austin. The same efficacy, the same side effects, but a little bit more comfortable.
When a story is so big like this, and it's somebody that everybody knows and it's covered in the news over and over, do you see an effect in your practice of more people coming in and trying to you know, go through early detection? That
would be great if there was an uptick in the number of people who saw their primary care or dermatologist for skin cancer screening, and for screening in general, whether it's mammography, PSA.
That would be a great outcome for all of this. Doctor, thank you so much for your time this morning. We're going to have this interview and more information on our website at KXAN.com.